This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. Hello, everybody. Welcome to Daily with Doc. My name is Becca Dukes, and as the hostess of this program, also the Director of Student Services for the Institute of Holistic Health, and a health advocate in taking what I've learned, not just what I've learned, but also what I have physically experienced through the instruction and direction of the doctor that we have on today. Today is something that speaks directly to me, as I was having lots of bone issues, and I know a lot of people are. No matter what we do, if we don't have a strong bone structure, we're going to have poor health, and it doesn't just pertain to the bones themselves, which is something that we're going to be learning about today. And we're going to be sharing a holistic approach to help you as an empowered individual be able to have strong bones, healthy blood, and enjoy life. So thank you so much for joining us. If you are watching one of the live streams and you would like to join us live here in the Zoom room, you are more than welcome to do so by going to zoom.dailywithdoc.com. That is Zoom, ZOOM, daily, DAILYWITHDOC.com. And you will be linked into the Zoom room. Now, we are live only between 12 and 1 p.m. Pacific time. So that's 12 and 1 Pacific, that's 1 to 2 Mountain, 2 to 3 Central, 3 to 4 Eastern, and 9 to 10 in South Africa. So you can figure out what it is in your time zone, and we welcome you to join us. Now, if you were invited by somebody specific, we want to make sure that you get back with the person that invited you. They cared enough about you and knew that there was going to be some information in this program that would speak directly to you. Not just speak to you, but empower you to be able to look at what you're doing now, what may not be working in many, many cases, and a solution that you can implement into your own lifestyle, all on your own. And you get with the person that shared this program with you, they can help you get started. Now, if there is nobody to thank and you would like to get started on a different health journey and include some of the things that you're going to be listening to today, you are more than welcome to give us a call at 855-949-3377. Again, that's for people who are not already working with somebody. We are a resource for an amazing community. We want to make sure that we maintain the integrity of this community. So if you were referred by somebody specific, they are your go-to person. All right. Now, with all that housekeeping said, just have to remind you one more thing. This program is not meant to take the place of your primary care physician, nor is it meant to treat, diagnose, or cure any disease, nor are the products that are mentioned in this program meant to treat, diagnose, or cure any disease. But folks, when you give the body what it needs and chemicals and things to suppress the body's natural response or hide pain, that's not what it needs. The body itself needs 90 essential nutrients. Plus, if you've got some decline going on, you need some extras in order to help the body do what it was designed to do. And that is to thrive, not just barely survive. And how do we know what the body needs? Well, folks, the doctor that we have on with us today, Dr. Joel Wallach, he has almost 30,000 autopsies under his belt, as he has 3 postdoctorates in pathology. He started out as a young boy having some difficulties of his own, found some solutions, and has really just ran with looking at nutrition to help not only animals, because he started out as a doctor of veterinary medicine, but also humans, where his path has taken him to find things that were said to be human genetic diseases that he found in a Ricci monkey and in a whole community that was not even related. And also getting fired for that, which I know every adversity reaps seeds of benefits. And we are going to be able to benefit from this doctor, who is now a licensed naturopath doctor in multiple states. And he is here to guide us as one of the founding fathers of the science of epigenetics that has proven the theory of disease transmission to be genetic to be incorrect. Yes, incorrect. Look up epigenetics, folks. Dr. Joel Wallach is one of the founding fathers of it, and I am super excited and honored to be able to have him as the main doc that started Daily with Doc here on with us. So Dr. Joel Wallach, welcome. Welcome to Daily with Doc.
Well, thank you so much for the kind introduction. We're family is the way I look at it. And I can't thank you enough for all that you do and all that the team does, all the way from South Africa to Europe to South America, Canada, the United States,
Australia.
We're in over 31 countries. And so I'm really so very proud of the team. We're all over the world. We literally see, I don't know, maybe 50,000 people a day through this whole organization. And it's really emotionally rewarding to be able to help so many people. So with that, I do want to talk about today osteoporosis and arthritis. Osteoporosis and arthritis, people tend to think of those as old people's disease. But babies can be born with osteoporosis and arthritis. Little kids, 1, 2, 3, 4, 5 years old. What?
Well, is this going to relate to things like osteopenia and brittle bones and that type of stuff?
Yeah, exactly. There's various degrees of deficiencies, and there's about, 200-300 diseases of the bones when it comes to osteoporosis and arthritis. And so doctors love osteoporosis and arthritis. repeat that doctors love osteoporosis and arthritis. That's because you can have it when you're an embryo, you can have it when you're born, you can have it when you're 1 year old, 3 years old, 5 years old, 10 years old, 20 years old, 50 years old, 75 years old, 100 years old, 120 years old, 300 years old. You can have it and still be alive and functioning, but you have all these deficiencies that produce these diseases. Okay, the two most common ones are arthritis, and you go back, well, arthritis and osteoporosis. You go back thousands of years ago, people learned that if they took the bones of the animals that they were eating and they would boil them overnight in some vinegar, okay, and they would drink the next morning, they called it bone broth. And for thousands of years, people were drinking bone broth every morning, and they didn't know what it was, but it was sucking the calcium and the magnesium and the phosphorus and copper and zinc and all those minerals out of the bones into the liquid, and they're drinking that every morning. And this is why people 2,000, 3,000, 5,000, 10,000 years ago, they wake up in the morning, they didn't have any bone problems because they're on bone broth, which is one of the first universal supplements that humans did other than salt. Okay. And so that was fascinating for me. And so it's one of those things where just because it's so universal in every age group, every race of peoples, every place on earth where there's people, age doesn't make any difference, gender doesn't make any difference. We pay out to doctors each year in America alone, each year, not to treat or cure arthritis, but just to treat the symptoms, $626.8 billion. $626.8 billion just to treat the symptoms of osteoporosis, of arthritis of the bones. Then we have osteoporosis. Okay, let's look at people tend to look at this community of United States, Canada, and European Union. Those three cultures together each year spend 6.5 trillion, not 6.5 billion, but 6.5 trillion just to treat the symptoms of osteoporosis in these three communities, United States, Canada, and EU. And so these same communities also have osteoporosis and arthritis. And so they're spending 6.5 trillion, okay, and also spending 626.8 billion. So we're looking at every year, you're looking at $7 trillion. $7 trillion we're spending just to treat the symptoms of arthritis and osteoporosis. Doctors love osteoporosis and arthritis because the patients usually don't die from those diseases, but they get all kinds of weird things going on. Because, for instance, a common diagnosis of osteoporosis of the skull. Doctors don't get taught about osteoporosis of the skull. I was seeing this at autopsy, okay, working my way through veterinary school on humans. And then I look at the clinical records, and the doctors never mentioned any osteoporosis of the skull. And this is what I saw in the dead human being. Okay, so I was realizing that, and I checked, and they weren't taught anything about osteoporosis of the skull. There's 12 pairs of cranial nerves, there's spinal cord, all of which generate in the brain and come out through the tunnels in the skull, going to the places on your body where they do their work. Okay, and so let's look at atrial fibrillation, which is the heart rate. Heart is just going crazy, vibrating instead of just beating properly. We have abnormal heart rate. Instead of having maybe 25 to 40 beats per minute, they might have 75 or 80 or 100 beats per minute. Okay, hiccups. Okay, the nerves controlling your diaphragm, okay, are being squeezed, causing hiccups, neuropathies. This is where you get pain in your toes, and doctors will amputate your toes. And it might be the 10th cranial nerve coming out of the skull, being squeezed, causing pain in your toes. And the patient didn't want to take all his drugs and everything for pain relief. So they just cut their toes off, okay? And then there's tinnitus, ringing in the ears. This goes along with osteoporosis of the skull. The skull is squeezing the 7th to 8th cranial nerves and causing ringing in the ears. And doctors just want to just go ahead and take your the internal hearing pieces out, and then you won't have tinnitus and ringing in the ears anymore. You won't be able to hear either. Okay. And then there's optic nerve atrophy. That's the big, big nerve coming out of the brain, going through the skull into the back of the eye. Okay. And it carries nerve impulses to the eye, telling the eye what to do. And then, of course, the eye is sending back information to the brain to tell the brain what it's seeing. Okay. And when the skull goes 95% of that tube filled up, because you've obviously approached the skull, you get optic nerve atrophy. Okay. Then there's trigeminal neuralgia. That's the fifth cranial nerve gets squeezed, pain all over your face and neck and that kind of stuff. Gastroparesis, this is the stomach, okay, and the belly, being squeezed. COPD, chronic obstructive pulmonary disease, that's obvious. The lungs, the nerves that control the lungs, okay, atrophy of the tongue and speech, malfunction, the nerves, we're talking about the nerves that control the tongue, and then Erb's palsy and other palsies. Okay, this has to do with things going on in your hands and arms and legs and so on. Parkinson's disease, we already found the cause, prevention, and reversal of Parkinson's disease. We're getting more and more people now using our I-26, and the Parkinson's disease thing is going to be something that's in the past. It's going to be history. Multiple sclerosis, also the I-26 is useful there. Remember, they still have to take the Ultimate Daily Classic tablets. Okay, you have to take the Healthy Brain and Heart Pack to get all the nutrition necessary for all these tissues, and especially the bones, to work properly and to develop properly and do their job. Polyuria, frequent urination. In other words, you're peeing 5 times an hour, okay, because those nerves that control the kidneys, okay, are squeezing. And that's why we came out with the Ultimate Daily Classic tablets. Okay, the Ultimate Daily Classic tablets will stop that. And of course, we are, what should I say, when it comes down to things like Parkinson's disease, this book is this flip chart, okay, 90 for Life Crusade to save humanity in the world. Everybody needs to get this flip chart, because in the back of this flip chart, there's 77 pages. There's about a dozen famous people. We're talking about athletes, and I used to work with these professional athletes and then save them. Theo Ratliff, his career was over because he had arthritis of his, there you go. Theo Ratliff, and his stories in this book, had arthritis, okay, of his hips and his knees, and they wanted to give him artificial joints or just take his legs off and give him artificial legs. He didn't want to do that. He said, I'll just retire and be a coach, because they weren't going to hire him with all those things going on. So we came up with the glucogel, okay, which rebuilt cartilage, ligaments, tendons, connective tissue, added that to the Healthy Start Pack. It became the Healthy Bone and Joint Pack. And then we also came up with our Rebound, our sports drink. We made all that for Theo. Well, he came back in 3 months after his career was over. He came back in 3 months, and he played professional basketball for 9 more years. And he made over $100 million in contracts because we made those products for him, these nutritional products, okay? It's one of those things where this is good for these famous athletes, but they're also good for you, okay? So it's one of those things where some of our best-selling products, because people buy them and they're looking for economical sources of relief, and they don't have to go to the doctor's office, all this kind of stuff. But then they learn, okay, in chapter 14 of the book Hell's Kitchen, and chapter 11 in the book Immortality, okay, and the entire book Metabolic Syndrome, and the diseases that afflict people with things going on with their bones and cartilage and ligaments and tendons and connective tissue. Now, how much calcium do we need every day? Now, I take about 2,500, 2,500 to 3,000 milligrams a day. There you go. Those are 3 great books. Everybody needs to have those and read them every couple of months. Read them again. Every couple of months, read them again, because they will add many healthful years to your life and to your family's life, and saving an enormous amount of unnecessary misery, saving an enormous amount of money. Okay. And so, again, we are doing great things when it comes to the osteoporosis, or it comes to arthritis. And when you look at our products, okay, our Cal Toddy has 1,200 milligrams per ounce. Cal Toddy
Of
has
calcium.
milligrams of calcium per ounce. Well, I take 2 ounces a day. Well, there's 2,500 milligrams right there. Okay. But I also take in 3 of the Ultimate Daily tablets. Okay. And that has 400 for every 2 tablets. And I take 3 tablets twice a day. So I'm getting 1,200 milligrams there of calcium. Then I take the Ultimate Daily Classic. Okay. And it gives me another 1,000 milligrams of calcium a day. And so I'm getting my 2,500 to 3,000 milligrams of calcium every day. And remember, I'm 85 years old.
Well, and you're also taking the Tangy Tangerine and the OsteoFX that are part of the Brain and Heart Pack, the Healthy Start Pack.
That's correct.
Which have calcium. But Dr. Wallach, is it just calcium that we need? Or are there other macro minerals that we need for healthy bones?
Oh, no, you need magnesium, you need phosphorus, you need copper, you need all kinds of stuff. And this is why I urge people to get a hold of these books. And again, Hell's Kitchen, published in 2004, Immortality, published 2008, Metabolic Syndrome, published 3 months ago, Let's Play Doctor, teaches you how to diagnose osteoporosis and arthritis, and teaches you what to take nutritionally to rebuild all your bones. This is one of our biggest selling books because of that, because of what we can do for people with osteoporosis and arthritis. Okay. And then we have, let's see here, the Wallach Revolution goes into all these things that the doctors said were genetic that aren't. And then you've already mentioned epigenetics. Okay. 500 pages. I'm one of the founding fathers of the science. It has replaced the science of genetics. Very proud of this, epigenetics. Okay. And then our biggest selling to date, the biggest selling book in CDs is, you were giving me figures yesterday, Dead Doctors Don't Lie. Now, I don't say these things to be mean. I'm a pathologist, and when you look at the bodies of human beings, and the doctor, well, the clinical doctors miss the diagnosis. The doctor that saw them last in the hospital and treated them improperly, and they died as a result. And then when you do the autopsy, you see that everybody was missing the target, okay? Because they were just treating the symptoms, okay? Painkillers are not going to fix arthritis. Painkillers are not going to fix osteoporosis, okay? And so it's a little bit more complicated than just taking a painkiller. Oh man, I love my doctor. I got rid of the pain. I can go out and play golf now. And then 3 years later, they're dead. The average lifespan of Americans, with all we have, with all the medicine we have, and all the doctors we have, and all the hospitals we have, and all the medical schools we have, we spend, okay, let's see here, excuse me, each year, oh, excuse me, let me go back. Each year, the average American, white American, lives to be 78. The white Americans live to be 78. Black Americans live to be 63 to 65. Okay.
Big difference.
Big difference. But both of them aren't meeting what the longest lived people on Earth, okay, the Hunzas in the Himalayan mountains, okay, and I believe they're the Pakistans, okay, and their life expectancy for their entire tribes is 120, and many will live to be 125, 150, 200, and so forth, because they're getting all these nutrients in the land flowing with milk and honey. Now, land flowing with milk and honey can occur in, I don't know, several hundred places around the world where the glaciers are grinding up the rocks and the white powder is in the streams coming down the side of the mountains, and it looks like milk. And so they're calling it the land filled with milk and honey where people live the longest. But here's the quirk. All glacial milk is not the same. Some only have 3 minerals. Some only have 10 minerals. Some only have 15 minerals. Some have 25 minerals. Some have 50 minerals. Some have 75 minerals. Some have 80 minerals. Some have 100 minerals. Some have 120 minerals. And so ones that have the most minerals are where the people live the longest. Okay. And so this is, and so all this are in these books. This information is there, is documented. And again, when you look at the books, okay, like Dead Doctors Don't Lie, how many of the CDs by lecture of Dead Doctors Don't Lie did you say? It was 343?
Over 350 million, and that was just a few years ago. That was the count a few years ago, Dr. Wallach. So, and folks, you can find Dr. Wallach's books at www.drjwallach.com. That is DRJWALLACH.com. There you will find all of his 25 publications, books, plus many audio lectures that can be purchased as well. There are a few of his books that are in ebook that can be purchased for download. And Doc, you've just done a lot in your short time.
Well, thank you. And of course, I expect it to be a long time because using the Chinese method of aging, I'm 85 years old. The Chinese give you credit for 9 months of pregnancy. So in the Chinese method of aging, when you're born, you're already 9 months old. We start our age count at birth. The Chinese start the age count at conception, okay, which I think is more correct.
Well, I think so too, Dr. Wallach. So based on what you've been talking about with the osteoporosis and with the arthritis, Brenda has a really good question. She says, what is the best protocol, diet, and supplements? So let's just start from the beginning. We've got somebody 100 pounds, Dr. Wallach, that's experiencing osteoporosis.
Okay.
And it can be anywhere, right? Not just in the fingers.
Not just in the skull, not just in your right arm, not in your pelvis. Okay, it's everywhere. Okay. And it's how you use your skeleton. You'll see more symptoms in those areas where you're using more. Where you have bones that don't do much work, you're not going to see a lot of symptoms. Okay. But they still, when you have osteoporosis, the bone marrow cavity, okay, fills up with connective tissue, scar tissue, and you get anemic. And so the doctor sees the anemia and he wants to treat the anemia. So he has you come in once a month and gives you an IV, blood, and so forth.
Infusions,
yeah, with the blood to raise your blood count. And that's because your bone marrow is not getting what it needs to be able to function properly and be healthy. So it's there asleep in your bone marrow cavity, okay? And so these are the sort of things, it's kind of like your car. If you keep putting water in your gas tank, are you going to be able to drive that car all the time? Nope. But
you're not going to be able to drive it at all, Dr. Wallach.
Yeah, but it registers on the front thing. It's the gas tank. Okay, the same thing with your heart and your bones and cartilage and so forth. You got to give it the right stuff, the right amounts, and constantly. We are a living, performing, utilizing, and requiring rebuilding critter. And so we need all these nutrients to maintain what we're losing because of sweat. Remember the bone broth thing. I remember, my parents and grandparents did bone broth, and I came up with a glucogel to replace bone broth, and glucogel added, okay, to our program, the Healthy Bone and Joint Pack. The Healthy Bone and Joint Pack was our Healthy Start Pack, which was our first program, our first product with the multiple nutrients in it, the Healthy Start Pack. And Theo needed more. He needed the glucogel. He didn't want to do the bone broth. So I came up with the glucogel for Theo and added it to the Healthy Start Pack, and we made it the Healthy Bone and Joint Pack. That's where the healthy bone and joint pack came from. Okay. That was such a success. We had athletes from every sport all over the world wanting that healthy bone and joint pack. Okay. And then everybody around the world picked up on it. And I'm just so very proud we've been able to help so many people of all races, genders, all different people from all over, help maintain healthy bones and ligaments and tendons and connective tissue. Bones also make red blood cells. They also have the make white blood cells. They also make antibodies and all kinds of stuff. Your bones are very important. They're not just something you sit on. They're not something you just take a pen and write with, okay? And so it's one of those things where I cannot impress people enough that I'd rather sit home a day and get that gasoline in my car and get all the nutrients in my body as opposed to running around town and looking at stuff and burning up all that gasoline. Okay. And you really, really want to make sure you're getting all the nutrients, and calcium is a big one. Just remember, makes your red blood cells, makes your white blood cells. Okay. Helps you with.
But we don't want to just take calcium, because that would be fractionated nutrition, right?
That's correct. No, you got to take, that's why we have the 90 for Life program. That's why we have the 90 for Life program. And of course, doctors hate that. Oh, you're anemic. Let's give you some iron. That's fine, but you need the other 89 nutrients. You need the other 59 minerals to go along with the iron. Okay.
Right.
And this is where we teach our people in longevity. Okay. And this is why we have the books, so you can refer to them as references and so forth. And the information in these books save people's lives. Okay. Because when you go to a doctor and they're giving you blood transfusions every month because your bone marrow is dead, because you don't have enough nutrition to keep your bone marrow alive and functioning, somewhere along the line, they're going to screw up and you will die in the hospital during that transfusion.
So you're able to build up the bone marrow and to bring it back, even if it's compromised? Oh yeah, because bone marrow are living cells, and they stop functioning because when your bones are unhealthy, they actually get thicker. Okay, they actually get thicker. Let me see here. It's all in your head. This is where I really, really understood what was going on. Right here? Yeah, there you go. You look at the top, you see that's a normal skull, 1/4 inch thick. They took the top of the skull off and the camera's looking down on the brain. You see the skull is 1/4 inch thick. And all the 12 pairs of cranial nerves are going out each side, and the spinal cord is coming out of the back of the skull. Now, the bottom one is a human skull. They've taken the top of the skull off. Their camera's looking down on the brain, but they've got osteoporosis, and the skull is 1.5 inches to 2 inches thick with scar tissue, not bone, scar tissue. The scar tissue is squeezing those tunnels that the 12 pairs of cranial nerves are coming through. And then go to the next page. Okay, go to the next page. The next page, on the screen on your left-hand side, you'll see all those cranial nerves coming out and going to the various parts of the body, and what disease you get when they're getting squeezed. And then the right-hand page there, okay, you're seeing the titles and the page numbers of the various chapters which those nerves are in, and goes into the diseases that occur when those nerves are getting squeezed or missing or whatever. And then when you get to that chapter, it tells you what secret sauce to give to the 90 essential nutrients. Don't just take the secret sauce. You got to take it's kind of like if you make a cherry pie. Oh, I just love cherry pie. So you just put cherries in the frying pan and fry the cherries and eat the cherries. Is that cherry pie? No. Okay. And so you have to take all the ingredients that's necessary for all the various factors here. And that thick skull will go back over a period of a couple of months. It'll slowly go back to normal.
and all the functions of those 12 pairs of cranial nerves, the spinal cord will return. And so you won't need surgery, you won't need 50 different drugs.
Right.
And we've been doing this for a long time. We've been doing this for over, more than 25 years.
Well, yeah, through Longevity Proper, it's been like 28 years. And even before Longevity Proper, you had American Longevity for some time. So there's a lot of history, folks, in being able to help people through nutrition successfully, because they do offer solutions. Now, if we're looking at a package, a supplement program, Dr. Wallach would recommend for osteoporosis, osteoarthritis, the Healthy Body, Brain, and Heart Pack with the glucogel. And with the glucogel, well, the Brain and Heart Pack is going to be 1 per 100 pounds. Glucogel is 1 per 10 pounds, up to 15 per day. So you do like 3 times a day. The MSM Ultra, that's going to help with the connective tissue. He was talking about the scar tissue building up in the bones. That's going to help keep that connective tissue where it's supposed to be. And also the Ultimate Daily Classic, which helps to clean the blood, promote circulation, so that all these nutrients that you're taking are getting throughout the body. And I-26, we want to make sure that you've got some great digestive health going on, in addition to giving the body what it needs, the liver specifically, what it needs in order to create that healthy sheath, that myelin sheath, that coating that doesn't just coat the nerves, but also the brain, and helps to protect. Did I forget anything, Doc?
85% of the brain weight is myelin.
Yes. And that is made from cholesterol. And the I-26 has the good cholesterol that is needed in order to support that function of the body. Now, Pete has a lot of pain in his arm, in the bicep area. The doctor did x-rays and subscribed to calcium deposits. So how do you get calcium deposits in the muscle?
Calcium deposit in muscle, usually it's from hemorrhaging, bleeding, loading a truck, bumping those arms one way or another, doing heavy work with your arms and shoulders. And when you have calcium deposits, in the muscles surrounding the bones, that means you're getting some leakages somewhere. Okay, the blood's bleeding out, and the calcium that was in the blood, when the blood gets absorbed, the calcium stays there, and that's where that calcium comes from.
So if you have too much calcium in the blood, is it because you're taking in too much calcium?
Not necessarily. It's being taken out of the bones.
So if you're not getting enough calcium in your diet and it's not being absorbed into the bones, then the body's going to need calcium for different areas of the body, and it pulls it out of the bone?
It pulls it out of the bones, and therefore you start getting arthritis and osteoporosis, but you're creating it yourself. Okay, when you don't have enough nutrition to keep that balanced. You want to be putting in as much or a little bit more than what you're taking out. Okay?
All right.
Yeah, and of course, the calcium levels in the blood have to do with blood pressure, and the function of the red blood cells, the white blood cells, the immune system. The bones are so important. Okay, and again, it's not a genetic thing, it's not an age thing, it's a nutritional thing. And I urge everybody to get a hold of that flip chart, 90 for Life, to save humanity in the world. And look at page 26, 27, 28. Okay. And it goes into the neurological associations, goes into the calcium stuff going on. And it just blows your mind how much stuff goes on that's related to bone health and function.
And it also has the good foods, bad foods list that's shown here in the flip chart. We have the good foods, bad foods list also on the back of the metabolic syndrome, another one of Dr. Wallach's books that I was honored to help write, because it was basically where I was at metabolic syndrome, with many of this cluster of poor health conditions. And you can also find the good foods, bad foods list on our website at DRJ Wallach. No. dailywithdoc.com. So you get Dr. Wallach's books at drjwallach.com. You can find replays of our programming here on Daily with Doc and the good food, bad food list and other articles that support your journey in being empowered to help yourself to create that good health story that you want to create. You can find those all at dailywithdoc.com. Now, Dr. Wallach, we have many hands up with many questions. We only have about 20 minutes. So we are going to go to questions now. The first question, first hand that has been up since the beginning is AJ. AJ, take it away.
Okay, because I know the routine. Dr. Wallach, thanks for being here. I have 3 questions, and I'll try and go as quickly as possible. One gentleman, his 80-year-old dad has recently had a cytoscopy and a TERP, the procedure to take away some prostate tissue to stimulate urine flow, because his dad is not going to the bathroom. He's wondering what he did to cause that and how to fix it.
Okay. So he weighs, do we know what he weighs?
Doc, I don't have the height or weight.
Okay, so let's go per 100 pounds of body weight. Okay, he needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, no iron, oats, no buckwheat, no sugar, no carbonated drinks. Even the diet one's got to go. Carbonation neutralizes stomach acid, so you cannot digest food and absorb minerals. Then you need him to have it, again, per 100 pounds of body weight, that one healthy brain and heart pack. One healthy brain and heart. If he weighs 150 pounds, I'd go with 2 healthy brain and heart packs, a full dose of breakfast, full dose of dinner time. And then let's see here. And so he's worried about his prostate, right?
Well, he's worried about urinating, but the doctor did a procedure to take some flesh out of the prostate that they thought would help him urinate, but they keep needing to put a catheter in him every couple of days.
Okay. Well, we have a solution for that. This guy is not the first one to have this issue. Okay. So in addition to the healthy brain and heart pack, in addition to, let's see here, let's start there, the healthy brain and heart pack. And I would also go with the Ultimate Daily Classic tablets. Ultimate Daily Classic tablets. That's going to help get blood flowing through blocked arteries into the brain, into the heart, into the liver, into the kidneys. But it's also going to support healthy blood pressure and healthy blood flow. Okay. And you're going to see miracles with that Ultimate Daily Classic tablets. Take 3 of those twice a day, 3 breakfast, 3 dinner. That'll be 2 bottles a month, the Ultimate Daily Classic tablets. And we also want him to have the rebound. Okay. It has 150 milligrams of plant-derived colloidal minerals. It's got every known vitamin known to human beings. Okay. And it's a great product. Tastes good. Little kids like it. It comes 30 sticks like this in a box. I go through 2 boxes a month. Okay. Because I take 2 of these a day, one at breakfast, one at dinner. You tear the corner off, pour it into a glass, or not a glass, pour it into a bottle of water, shake it up real good, and drink on that for half a day. The second one, do the second half of the day. Okay, that's called rebound. That'll give them energy, but it also help the kidneys function and do their job, blood pressure, urination, that kind of thing.
Okay, awesome. Thank you very much, Doc. The second question is another human question, which is from Nancy. She says, my heart is racing at 215, and my doc wants me on a beta blocker. All of the heart tests were normal. The meds made me ache all over. What can I do naturally to lower this heart racing? It happened after a steroid shot in my hip 4 months ago.
Okay, now let's stop there. let's see here. She weighs how much?
She does, again, I'm sorry, Doc. I don't have a height or weight or an age on this woman.
Okay, well, let's go, per 100 pounds body weight. You need to get rid of all the bad foods, no fried foods, no processed meats, no oils, no glutens, no wheat, brown, rye, no buckwheat, no sugar, no carbonated drinks. Even the down one's got to go. And then she needs, let's see here, 1 healthy brain and heart pack per 100 pounds of body weight. If she weighs 140 to 150 pounds, she needs 2 healthy brain and heart packs per month. And then she needs, because she's got the, let's see here, am I on the right one? Oh, yeah, 215 pounds. 215.
That's the heart rate is 215.
Heart rate, okay. Okay, the heart rate 215. I want her to have the Ultimate Daily Classic tablets. She can take 3 of those at breakfast, 3 at lunch, 3 at dinner time to start out with. That'll be 2 bottles a month of the Ultimate Daily Classic tablets. And that's going to help control her heart rate, help control the kidney function, help control blood flow into the liver and the kidneys and the heart and the brain. But I would also have her take the I-26. She could take 3 of the chewables at breakfast, lunch, and dinner, or 3 of the capsules at breakfast, lunch, and dinner, or 3 scoops of the powder at breakfast, lunch, and dinner. And that's going to help regulate cardiovascular function, help regulate what's going on in the brain and the spinal cord, because that may have some relationship too. But, call us 2 weeks after she starts, but she can start out by getting rid of the bad stuff, because it'll take a couple of days to get the product, get off the bad stuff immediately. Put the bad foods, okay. I would either grind it up and give it to your dog, or give it to, put it in your garden or something like that, but don't give it to any human being.
How about de-stress, Dr. Wallach?
Say again?
How about de-stress? It helps to relax and slow things down. I know we use that often.
Fine. Yeah, if finances are not a problem, I can give a whole list of things to take, but de-stress is good. Yeah, absolutely.
Okay, just my last one, Doc. Carrie has a 70-pound German Shepherd, 6 years old, has been itchy her whole life. She scratches and chews her fur, and the skin turns into bloody, scabby patches. She was on the Arthrodex, but the prior to that, the vet gave her Cytopoint shots and said it was a seasonal allergy, and all the dogs are getting them. But then last summer she was doing okay, but this summer it's just not doing as well. She's itching all over the body. She tried, and that's the basis of what we got here. An itchy dog, and has raised dots on the hairless areas of her skin.
Okay, so wouldn't hurt to change dog foods. Okay, go to canned dog food instead of dry dog food. Make sure read the label, make sure it's got all the vitamins and minerals in it. Don't just get ground meat. You need to get the vitamins and minerals in the canned dog food. Then also needs an Arthrodex. Read the label for the Arthrodex to see how many that this 70-pound dog needs. Okay, the Arthrodex. And let's see here. Oh, hair, skin, and nails. Hair, skin, and nails. Go ahead and take 2 of those 3 times a day. Hair, skin, and nails. And that gives the skin specifically what it needs to stay healthy and to ward off simple irritations that cause, what you're describing. Okay.
I was thinking, Doc, there's a formula that we have that has the I-26 in it for dogs. You think that might be helpful?
Well, I-26, they're going to have the I-26. It comes in powder, comes in capsules, comes in the chewables. Yeah, a lot of people give their pets I-26, absolutely.
And there's a formula specifically for dogs called Dog Companion, I-26 Companion, Doc.
Well, there you go. I-26 Companion.
So,
Thank
all
you,
right.
Doc.
Thank you so much, AJ. Let's go ahead and go to the next hand that is up, and Phyllis. Take it away.
Hello, Dr. Wallach.
Hi.
We've got a question from Julie on Facebook. And this is for a woman, 56 years old, 112 pounds, 5'1". And the question is, what causes her vertebrae in her back to compress? How can we help that?
Okay. There could be many, many things, but it could be, as we've been discussing earlier, osteoporosis, could be arthritis. And so, because the vertebrae are bones, okay? And if you have something going on in your hips and your knees, and your shoulders and your fingers, it can be happening, okay, in your vertebrae as well. And it'll affect the posture. It'll create all kinds of pain. It'll create all kinds of peripheral neuropathies because when the thickness of the disc between the vertebrae gets thinner, vertebrae get closer together, they start squeezing those nerves that are coming out from the spinal cord in between those vertebrae, okay? And so here's again a case where this gal, 100 and, let's see here.
112 pounds.
112 pounds, okay, 112 pounds, couldn't read my own writing there. 112 pounds, needs one healthy brain and heart pack per month, take a half a dose of breakfast, half a dose of dinner time. Take 1 bottle a month of the Ultimate Daily Classic tablets, take 2 twice a day, the Ultimate Daily Classic tablets, take 2 at breakfast, 2 at dinner time. Then needs a glucogel, take some extra glucogel, take 3 of those twice a day, and that'll help rebuild the disc between the vertebrae and also the bone matrix, the non-bony stuff that the bony minerals sit on in the vertebrae. Okay. And then of course for pain and posture relief, we do have the CM cream you can apply topically, say once every couple of hours, and get really very significant pain and discomfort and function relief. Okay.
That sounds really good. And we've got one more question from Joe. And he's wondering if oils that go rancid, do they only affect the heart and arteries? And he brought up arterial calcification.
Okay, you're talking about salad dressings and cooking oils and things like that to go rancid?
I assume so, yes.
Yeah. Okay, it causes oxidation damage in every tissue in the body. You do not want to save a few pennies and kill yourself because you're trying to save a few pennies. I wouldn't even give it to my enemy. Okay, yeah. And anytime you have oils of any kind that you've had for a while and they're getting cloudy and stuff like that, and they taste sort of acidy, don't use them. Don't give them to anybody else. You can just dump them in the garbage.
And we're talking about every cell in the body. This isn't just in our cardiovascular thing.
That's correct.
Now, what about
that will damage the lungs, it'll damage the liver, it'll damage the kidneys, it'll damage the brain.
And what about that arterial calcification? What does bring that on?
Okay, well, arterial calcification again is caused by inflammation. Eating fried foods, eating oils that have gone rancid, those kinds of things will cause irritation to the lining of the veins and the arteries. And the veins and the arteries respond to defend themselves by putting minerals in there. It starts out by putting connective tissue in, like tendons, and then the tendons and connective tissue attract the minerals.
So the arteries and veins are trying to apply Band-Aids essentially.
That's correct. Protective
tissue
cells.
And
here's
so
yeah, and here's again where the I-26 comes in. Okay, it can really help speed things up when it comes to healing. But you got to get rid of the bad stuff.
And I imagine that MSM would be helpful too.
Absolutely.
All right. Thank you so much. Back to you, Becca.
All right. Thank you, Phyllis. And Doc, we have 2 more people with questions and their hands up. So let's see if we can get through both of them. We have 8 minutes. And Renee, go ahead and unmute yourself. Renee, can you unmute yourself, please? There we
Howdy.
go. Howdy. What
Hey.
question do you have for Doc today?
Well, I was curious on what is your view on kombucha or kimchi?
So kombucha, kefir, kimchi, things that are like fermented vegetables and drinks. Dr. Wallach, what are your opinions on them, as they do have good probiotics?
Yeah, and of course, they're Asian foods, and we look at the Asians, they live longer than we do, okay? And
Sauerkraut.
yeah, exactly.
Is it good to use them on a regular basis?
Okay, I personally don't, but what you want to do is ask some Asian communities what they feel about those things. You know, they say, you guys are famous for this stuff. Are there any negatives, or is everybody happy with it and they take it their whole life? They start taking it when they're 1 day old and they take it when they're 200 years old. I mean, so those are the people you need to ask. Okay.
But I'm the client that you have with Guillain-Barré, and I'm allergic to everything. So I actually have had to cut out dairy in my food chain. So now I'm plant-based. So what do you think about that? I don't know. I'm trying to get
Okay,
better.
you cannot be just plant-based. You have to eat some fish, you have to eat some poultry, you have to eat some red meat, whether it's lamb or beef or something. You can't just
Well,
split.
no, I do eat meat. I have occasionally I'll have chicken and beef,
Okay.
but mostly my dairy for anytime we cook with milk or butter, we use the plant-based. And not that I want to, but my body will not accept right now, except regular butter or milk or whatever.
Okay, well, if your body doesn't accept it, don't take it. Okay, but you do need to take some animal products, which you say you're doing. Okay, good. And then again, you want to take your 90 essential nutrients.
I do.
Okay, good. And then give us a call in a couple of weeks and give us some more information. Okay.
Okay.
All right. Thank you, Renee. And from my own experience, I did a lot with kombucha and kefir, whether it was water kefir, milk kefir, especially when I was having some major digestive issues, and they were very beneficial in helping me with my health journey when I was getting started with longevity on the products, and really did help with, I think, contributed to my weight loss as well. So there's a lot of benefits where you're getting the prebiotics, probiotics, things that are helping to create a healthy gut biome that can be found in those. For those that don't do kefirs and kombucha, you do want to make sure that you're using, well, a lot of the things on the market have a lot of sugar, which then feeds the bad bacteria as well. So there are a couple products that are offered from longevity. There's the Integris probiotic. That's one. We have the Daily Digest, which has enzymes and also pre and probiotics. And there's also the Pre Plus probiotic sprinkles, which are just a little tube. You sprinkle them on your tongue, a pineapple citrus, absolutely taste fantastic. And at bedtime, you can take 2 of the nightly essence, and it works on the digestive system while it's not being continually fed. So there's a lot of things that you can do to help support your digestive system in regards to overall health. So Dr. Wallach, let's get to one more question. And Keely, go ahead and unmute yourself, please.
Good afternoon, everybody.
Hello,
I-
Keely.
How are you? Can you hear me?
Yes.
Yes, ma'am.
Okay. I have a 64-year-old female, 5'4", 150 pounds. She actually is a recovering alcoholic and was found after 36 hours. They said that she had the hepatic encephalopathy, which was her liver couldn't filter her toxins. They thought that she was somehow brain affected and that she had a bleed in her colon and her stomach. They gave her 3 units of blood, and it somehow did something to her lung respiration, and she ended up on a respirator for 7 to 8 days. She has now been taken out and put in a skilled nursing home. She does know who she is. She knows, she's got some cognition. She knows her name, her address, and she wants to go home. But they're telling her that her liver is unrecoverable, and she comes from a family that works in the medical field, and they are non-believers about the liver being recoverable or her being able to recover. What do you have to recommend and say to them?
Well, she needs to get rid of all the bad foods, no fried foods, no processed meats, no oils, no gluten, no wheat, bran, right, no buckwheat, no sugar, no carbonated drinks. That one's got to go. And then at 150 pounds, I'd have her take 2 healthy brain and heart packs per month. Okay, and if that's kind of too much for her financially, or just she doesn't want to do that much, she could start out with 1 healthy brain and heart pack, take a half a dose twice a day, or if she's taking 2, take a full dose twice a day. And then she also needs to, when it comes to, let's see here, alcoholic. What would we do for alcoholic? Oh,
Dr. Wallach,
I-26.
there is the I-26, and there is also the liver detox.
Okay, liver detox. There you go. We got 2,000. Okay, but Rebecca has seen so many different pathways that people have had, okay, and have walked with them. So she's giving you good advice there. But start out with nutrition, get rid of the bad stuff, and we have some good things coming along here. We're finishing up all the book work, so when it comes out, they'll have books that people have, so they can read the information and so forth. But this is one of those things where I-26. Go ahead. I like the chewels. I take 2 or 3 of those twice a day. I like the French vanilla, but it also comes in banana coconut. I think that's correct.
Yes.
Yeah. And
so Doc, what would you say in support of her? The family, because they're from the medical field, they don't believe that liver is recoverable.
Well, how old is she?
67.
Well, she's old enough to make her own decisions. And she can say, stand out of my way, guys, because I'm going to try this.
Okay.
So,
Okay,
Dr.
last
Wallach,
Go ahead.
is it possible, Dr. Wallach, is it possible for the liver to regenerate?
The liver has an enormous capacity to regenerate. The liver has so many functions in the body, okay? It has an enormous, there's so many alcoholics we've dealt with, okay? You get them on the 90 essential nutrients, get them off all the bad foods, and get them on some of these other products, like the Ultimate Daily Classic tablets, that kind of thing, get more circulation going in there. Because it helps with blood flow through blocked arteries in the brain, the lungs, the heart, the liver, and the kidneys. I just love that Ultimate Daily Classic tablets as an add-on, and that will help her enormously.
Keely,
Okay,
did you have
thank
another
very
question?
much. Actually, I do have a 4-year-old who keeps ending up with tonsillitis. His mom has him on the toddy and the other gut products as well. But she was asking, she says, what do I have to do to actually continually prevent this, given the fact that the medical community, of course, wants to cut out the tonsils?
Colloidal silver, tastes like water, looks like water, smells like water, won't burn, no alcohol in it. It's been used for over 400 years to get rid of these sort of diseases. It kills all viruses, all bacteria, all fungus, and all yeast. Dropper full under the tongue on the right side, dropper full under the tongue on the left side. Breakfast, 5 minutes before lunch, 5 minutes before dinner time, and 5 minutes before bedtime.
Okay, good to go. Have a great day.
Okay, guys.
Awesome. Thank you so much. Lots of questions that we got through today, Dr. Wallach. I know for a fact that this episode is going to be touching a lot of lives. And folks, if you are watching, you're not watching just to hear it come in one ear and out the other. Share it with someone you know. If you have social media, share it on your social media. Dr. Wallach, thank you so much for all of the information that you have shared today. And, you know, your research and your work is not going void. It's just, it's being shared around the world.
Let's get it around there. Let's get it into people's hands and in their mouths, on their skin.
Absolutely.
Okay, bye-bye.
Absolutely. Now, if I could have our co-hosts up on the screen with me, I know, Doc, you've got another thing to get ready for. We just want to thank you once again for all that you've done, being the leader of this crusade that we are on, and allowing us to be able to help others, not just help others, but also get a thank you check for helping others. And there is no greater career or purpose than to be able to help others find a better health journey and enjoy life. Thank you so much, Doc. We appreciate you greatly.
Well, we appreciate each and every one of you. Thank you. We're a family. We are a family. Remember, that's the greatest part. We're a family, and we love each other. We respect each other. It's just a great thing to work with each other because we're all going in the same direction to help the world. Adios. All is funny best taught sins.
All righty, everybody. So thanks for joining us today on Daily with Doc. And that's Dr. Wallach is there. And we have our host, Becca Dukes. We got Albert in South Africa. We got the lovely Sherry and Ruth Ellen and Phyllis and Marilyn, all doing their fantastic jobs for the show. And there's Becca Dukes.
Recording stopped.
And we will see you tomorrow with pharmacist Ben Fuchs. So please join in. And
Recording in progress.
There's our leader. She's back. And if she unmutes herself, she can take us out.
All right. Thank you so much, everybody. Technology is absolutely fabulous until it's not. But thank you again, everybody, for joining us here on Daily with Doc. Did you do the introductions and thank everybody? Yes, you already did all that? All right. Fantastic. We will see you tomorrow on Pharmacist Fridays with Pharmacist Ben. Thank you, everybody, for joining us. Make sure that you are subscribed to our channels, whether it's a Critical Health News or Critical Health or Daily with Doc. We are on so many different platforms so that you can easily find us and easily get the information you need or need to help someone else in this thing we call life, because we do not have to deal with poor health, folks. Even if you've started on that journey and things are just not going the way that you want to go, you can make U-turns. And that's one thing that I absolutely love about what Dr. Wallach has done. The company that he originally started called Longevity, and the products that they have taken, it's not the products that heal the body, folks. But when you look at those ingredients and even study those ingredients on PubMed.gov and all of the documentation that supports the use of those nutrients in helping the body, and then you synergistically blend them together, the body itself can do some amazing things like thrive instead of just survive. So folks, give us 90 days, get back with the person that shared this program with you. If there is no one to thank, give us a call at 855-949-3377. And if we did not get to your question, email us questions@dailywithdoc.com. That's questions@ dailywithdoc.com. And if you would like to join us on this journey, on this crusade to help others around the world, you can. You absolutely can. Again, the person that referred you to this program is your first point of contact. Get with them first. If there's no one to thank, you can even email us at info@dailywithdoc.com or call that phone number, 855-949-3377. My name is Becca Dukes. Thank you again for joining us here on Daily with Doc. We look forward to seeing you tomorrow. And if you're interested in becoming a certified holistic health coach with us, coach.dailywithdoc.com. Then that's am I right, AJ? dailywithdoc.com. 2 thumbs up. Yay. All right. Thank you, everybody. Until next time. Bye for now.
Goodbye.
Bye, Doc. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach. This program is for educational purposes only. The content is not intended to diagnose, treat, cure, or prevent any diseases, nor is it intended to take the place of your primary care physician. The statements in this program have not been evaluated by the FDA. Testimonials are shared as individual experiences, and the individual results vary and may not be typical. We do not make any claims regarding health or income. As an empowered individual, you do have options available. We are honored to have a founding father of the science of epigenetics guiding us with the best options to obtain or maintain optimal health, Dr. Joel Wallach.